Good afternoon, everyone. I believe you are all doing well and enjoying your Saturday, as well as making your health and wellness priority. Welcome to Health Focus, your one stop health and wellness enlightenment program. As mentioned last week, we have been on Citizen FM 93.7 Abuja since the beginning of this year, and you can join us live on radio every Saturday morning on Citizen FM 93.7 Abuja, or you can join the link in the comment section. That link takes you directly to the program at 11:30 every Saturday morning. My name is Catherine Adunola Abimbola. I am the anchor and producer of the program. Earlier today on the program, we talked about transmission of mother to child of hepatitis. This was a follow-up to our discussion last week on the disease. Our guest on today's episode was still Dr. Samuel Adedayo Sonibare. He is a fellow of the National Postgraduate Medical College of Nigeria, a consultant medical microbiologist, and a sexually transmitted infections and HIV physician with the National Hospital Abuja. He gave detailed medical explanations about the transmission of mother to child of hepatitis. Now, I want to thank you all for your feedback last week. They are really encouraging and will appreciate you to keep them coming in on all our social media platforms. Twitter is at healthfocusngr. Email is healthfocusniger@gmail.com. Our YouTube is healthfocusnigeria. And our WhatsApp number is 07040282777, while our Facebook page is Health Focus Nigeria. Permit me to repeat. Twitter is at healthfocusngr. Email is healthfocusniger@gmail.com. YouTube is Health Focus Nigeria. WhatsApp is 07040282777, and our Facebook page is Health Focus Nigeria. We await your feedback on any form of issue that you want us to ask. We'll refer to our doctor to give necessary medical advice, and you can give us suggestions how to serve you better on this program. Let me give summary of today's episode. I believe you remember that we said last week that hepatitis is an inflammation of the liver, and the condition can progress to liver cancer, and that there are 5 main hepatitis viruses referred to as types A, B, C, D, and E. Hepatitis A and E are caused by ingestion of contaminated food and or water, while B, C, and D usually occur as a result of contact with infected body fluids. Hepatitis B and C particularly lead to chronic disease in hundreds of millions of people, and together are the most common cause of liver cancer. The modes of transmission for these 3 viruses include receipt of contaminated blood or blood products, poor medical procedures using contaminated equipment, and particularly hepatitis B transmission is the one that is done from mother to child. And that was our cross of the episode earlier this morning. A pregnant woman with hepatitis B can easily infect the baby. This can happen through delivery, any form of delivery. And when a pregnant woman has hepatitis B, healthcare providers are set to give a baby, or the baby is depending on the birth, a set of shots at birth immediately to prevent the baby from getting infected. Now, let us listen to Dr. Sonibare from snippets of today's episode.
Sub-Saharan Africa is known to be endemic for hepatitis, especially hepatitis B and C, and that the WHO puts it that the carrier rate in Sub-Saharan Africa is about 8 to 20%. Wow. So this is responsible for a lot of mother-to-child transmission. The challenge about mother-to-child transmission is that in adults, less than 5% of adults, from documented evidence, goes to chronicity. Less than 5% of adults will end up with the hepatocellular carcinoma or cirrhosis of the liver or liver failure. Less than 5% of adults will end up that way. But 20 to 50% of under 5-year-old children would get up to hepatocellular carcinoma or cirrhosis of the liver. That is when the challenge is. Most of these under 5s get it from their mother through what we call vertical transmission. That's mother to child transmission, either in utero or when the child, especially when the child is passing through the birth canal. Some people say maybe breast milk, but the major challenge is when the child is passing through the birth canal.
Process of giving birth.
Yes, that's why you see that emphasis are particularly placed on mothers so that they will have vaccines. They also have hepatitis B vaccine when they are pregnant, except if the woman does not do it or her hepatitis status is known. That's why part of the initial screening of women when they go to hospital, when they go to good centers where antenatal is rendered, is that they have the hepatitis B screening done. And many of these women, they are found to be hepatitis B positive. There is a treatment that is given to the child immediately the child comes. The child has what we give a passive immunization. The child takes the hepatitis B globulin immediately after birth, and the child is actively immunized against hepatitis B so as to prevent the child from coming down with hepatitis B. Hepatitis B mother-to-child transmission is a very serious challenge in the sub-Saharan Africa. That's why when women go to good centers for antenatal, even in most centers for antenatal, they are screened for hepatitis B as part of.
Yeah, I believe you learned something vital about hepatitis, especially transmission of mother to child. We will expect your questions and or comments on our social media platforms. Twitter is at healthfocusngr. Email is healthfocusniger@gmail.com. Our YouTube page is healthfocusnigeria. Our WhatsApp number is 07040282777, while our Facebook page, of course, is Health Focus Nigeria. Please make it a point of priority to take very good care of your health, bodily and mentally, and don't mock anyone with any medical condition. You never can tell. You really never can tell. If you can help, fine. If you cannot, don't mock anybody with any medical condition. Let me remind us again that we will await your feedback on all our social media platforms. Twitter is at healthfocusngr. Email is healthfocusniger@gmail.com. Our WhatsApp is 07040282777. YouTube page is Health Focus Nigeria, while our Facebook page is Health Focus Nigeria too. Next week is another time. We'll catch up with another topic. I am Catherine Adunola Abimbola, your regular host, saying thank you for watching. Take care of your health. Bye for now.